Before we jump into today's episode, I wanted to remind those healthcare executives out there that are from small and rural healthcare organizations that Capstone provides complimentary consultations. As you may know, we help small and rural healthcare organizations to be the provider and employer of choice to keep care local and margins strong. Go to capstoneleadership.net and you can fill out the contact form there or actually self-schedule a day and time that works for you. We'd love to partner with you in executing a winning strategy.
Think about the change in that department, the culture, the behaviors in that department, how they shifted over the course of a year because of one goal. Welcome to Culture Change RX, the podcast for healthcare professionals that are committed to creating a thriving workplace culture, improving the experiences of employees and patients, and ultimately unlocking their organization's next level of potential. I'm Sue Tetzlaff, your host and co-founder of Capstone Leadership Solutions. Join me and my insightful guests each week as we share actionable insights for navigating the crucial people side of the business of healthcare. Subscribe now for a weekly dose of Culture Change RX. Now let's dive into this week's conversation where culture change takes center stage.
Hey there, it is Sue, and here I am for another solo episode that we call a Culture Byte. And today, again, just like last week's episode, I'm going to be sharing a story that inspires. This time, this story is about how goals and having goals and setting goals and engaging employees in the process of setting and achieving goals really is an amazing tactic for being able to help organizations not just achieve more, but to actually elevate behavior and performance and contributions of individual members of departments, entire groups of people in departments. And it's amazing how setting and achieving goals becomes a pathway for doing things in new, better ways. So this is how we do things around here. Becomes we do things around here in new, better ways, and we get new and better results. And I love this story about a housekeeping department. It is such a great story of how setting and achieving goals makes a difference for entire organizations, definitely departments, but even the individuals within them.
Heather was brand new as a leader. And in the organization where she works, they have a process or a cycle for setting goals at the organization level and the department level. Now she's the head of a department, the housekeeping department, and she's never done this before. This is new to her. The organization has been doing it all along, but she's never done it before. I happen to be her new boss. Heather works for me. And Heather comes to me as we're preparing to set goals for the organization and the department that year. And she says to me, Sue, I really need your help. I've never done this before. I want to do it well. Will you help me when it comes time for my department to set their goals? So in our organization, the process was this. The pre-cycle, which is the time before the annual goal period, we would have activities where the organization would update its strategic plan. Then 3 to 5 top organizational measurable goals were set. And then from there, departments created aligned goals, 2 or 3 specific goals aligned with one of those 3 to 5 organization goals. And again, Heather had never done this before, and she wanted help. So we worked together to set up a meeting with her team in which they would share all of the information about the 5 organizational goals that were set that year so that the housekeeping team could understand what are these 5 goals that are set for our organization this next year. So I helped Heather prepare how she could explain those goals to the housekeeping staff, what they were, why they were chosen, and why they're important. And then we created information that Heather could share with her team to share how are we doing as a housekeeping team? What kind of results are we currently getting? What were the results of our latest employee satisfaction survey, what results came forward from our patient satisfaction regarding cleanliness on the inpatient and outpatient side, how are we doing as a housekeeping team with our expense budget, things like that. So she started to share information about their vacancy rate, their turnover rate in their department, key information that spoke to the operations of their department. Where were those results currently and how were they trending? So we put together the organization's goals and a presentation on that and a brief presentation on the results of the department. Then Heather asked a simple question of her team. What 2 or 3 goals could we set as a housekeeping team in this next year that would help our organization achieve its top goals? What can we contribute? What are our unique opportunities? And there was Maggie in the back of the room. And Maggie is a housekeeper that's been on that team for almost 30 years. And what I know about Maggie is she can't read or write. She's illiterate. And I know this because each time they had to do their mandatory annual training, and it was a paper test that she would have to take, she couldn't read or write it. And she needed to be accommodated. And I knew that about Maggie, that she couldn't read or write. But what I learned in that meeting that day is that Maggie was the smartest person in the room. She was the smartest person in the room because Maggie raised her hand when Heather asked that question. What are 2 or 3 unique opportunities or goals where we really could improve that would really align with the organization's goals? And what Maggie said was this: we need to decrease absenteeism. We need to set a goal for this. And Heather and I looked at each other and we said, Maggie, we haven't mentioned anything about attendance or absenteeism. Why do you think a goal for absenteeism is what we need for our team this year? And she said, well, you shared with us that on the employee satisfaction survey, it said that our teamwork score is the lowest. And it doesn't feel much like a team when people don't show up for work and they leave you short. You shared with us that our turnover rate is high. Who wants to stay on a team where people don't show up for work and leave you short? You showed us on the finance report that overtime is increasing year after year, and we're spending tens of thousands of dollars on overtime. And that's because when people call in, we have to call in people at overtime to cover their shifts. And some of us are getting burnt out. Even though we like that extra money, we're getting burnt out from working all those extra shifts. And it's costing the organization money. You showed us that the cleanliness scores that the patients rate us on for inpatient and outpatient are in the bottom 25% of the country. You can't have a very clean building if people don't show up for work to clean the building. So Heather and I, we looked up the information. What was the attendance problem here, right? And Heather knew in her gut that it was a problem, right? Because Heather, every day, part of her managing day-to-day operations was what? Trying to staff her department, trying to cover shifts where people called in, right? So Heather knew there was a problem, but she hadn't quantified it before. It wasn't something that she had considered as possibly one of their goals. So that's one of the things here is that when you go into a goal selection process and you're facilitating that with your employees, it's not like going in saying, hey guys, I think these should be our 2 or 3 goals this year. Do you agree? That's not the process. The process is to really allow that ownership. It creates a social contract when people are part of selecting the goal. So it helps them work towards the goal and buy in and own the goal when they're part of the process of selecting it. And it's not done to them, it's done with them. So the leader's role in setting goals at the department level is to foster that type of engagement, such as Maggie was providing on that day. And so when we looked at the attendance, 246 absences in the past year was their baseline. Some pay periods of 2 weeks, 30 or more shifts were called off. So think about the activity going on, the reactive activity, the urgency going on every day, taking up the time of leaders and employees to clean the building, get people to work overtime or work short. And think of the impact on the finances, on the employee engagement and satisfaction, all of those things. So they decided to set that as a goal. And then we asked the question, how much should you improve it in a year? How much do you want to decrease it by? And they said, let's get below 150 in the first year of work towards this. That's more than a 40% improvement. I would have thought, wow, a 20 or 25% reduction and it would be great. But when we asked them, they said, let's get to 150 or less. And so then we asked the question, what are you going to do about it? What's the action plan? What 2 or 3 things could you just start that would move you on your way to decreasing absenteeism? And what happened was they set up just a couple things at first. One, they decided to track it and transparently report it. What they did is they created a graph that went on their office door for, their department. And this graph showed, and it was updated every payday, and it showed how many absences happened in the last payday. So in the last 2 weeks, how many absences? And then they created recognition for attendance. So they started to positively recognize attendance. And so what they did is that if somebody had perfect attendance for a payroll, their name went up on a board as having no call-offs in that pay period. And then at the end of each quarter at their monthly staff meeting, they would recognize all of those employees for the number of times that they had had perfect attendance in a payroll, and their name would go in a drawing for a $25 Visa card. And after the first quarter of doing just that, and then one of the housekeepers found a dollar banner at the banner store that looked like a thermometer, and they decided to also use that. And every time there'd be an absent, they'd mark it to get us closer to 150. They'd show the 150 on there, and they wanted to stay below that 150. And so that's all they did to just start. They created the goal, agreed on it, started to measure the frequency of absenteeism, and to recognize those that showed up. And it started to improve greatly after the first quarter. Then when they got ready for the second quarter, they said, what else could we do? And they decided what they would do is they were using a process called peer panel interviews to fill their open positions. And they decided to ask behavioral-based interview questions, new questions related to their goal about dependability and showing up for work. And so they changed the interview questions for all the new people they hired to be on their team. And so they kept going with the monitoring, the recognition, and now filling those vacant positions with hopefully more dependable people. And so it was going pretty well. We're about halfway through the year. They're trending to meet their goal. The data is looking like the decreases are going to get them below 150 before the end of the year. And it became summertime. And what we do about summertime when we look back on their absenteeism was summertime was some of the highest levels of absenteeism. Now, where we live in rural northern Michigan, where we can get a lot of snow and our winter is very long, summer is precious. And our time, away at the lake or at the cabin or whatever is precious. And so we saw a lot of, history of low attendance or poor attendance in the summer. And we started to see that in the data, that as summer hit, that people, calling off their shifts started to increase again. So at one of the meetings, they said, what are we going to do about this? And they said, what if we had a challenge? What if we did a challenge that if we've never had a payroll where everyone had perfect attendance, right? People have perfect attendance, but not everybody has had perfect attendance ever in a given 2-week period. So they decided to put out a challenge that could they have a perfect payroll, nobody calling off their shifts. And that is exactly what happened the very next payroll. And one of the things that they knew about this challenge was if they met this challenge, they would all get a $5 Dairy Queen certificate. Now, that isn't much, is it, you guys? A $5 Dairy Queen certificate was the reward for perfect attendance. But where we live, Dairy Queen is like only open for a few months, and it's really symbolic that it's summer. And, it's something that people really do like. And so we gave these $5 Dairy Queen certificates when they had their first payroll with perfect attendance. But I'm not sure that anyone bought ice cream with those certificates, because what I saw was behavior like this. Wanda, who was the housekeeper down in the ER, I saw her one day pulling out that certificate out of her pocket and showing the ER doctor. And she said to him, "Look what we got. We got the certificate because our team had perfect attendance in the last 2 weeks, and we've never done that before. We have a goal for decreasing absenteeism to below 150 this year, and we're going to do it." She was so proud. And then I saw her going to the nurse and then the tech. She was showing everybody. She was so proud that their team was doing this and that they had achieved this challenge and that they were going to achieve their goal. Fast forward to the end of the year. So just as they were getting ready to close out the year, they were at 146. And the last pay period of the year included Christmas and New Year's Eve. And they also knew that that was a time frame of very high absenteeism for their department in the past. And this is when you know that goals are top of mind, that they matter, and that it creates a social contract within a team when they work together to set and achieve a goal, and that it starts to change behavior and culture in a workplace. Was that 2 examples happened in those last 2 weeks that just speak volumes to me. One, I was doing some rounding on the night shift on one of the inpatient units, and Bob was a floor finisher. And he was down one of the hallways in one of the corridors in one area of the hospital as I was making my way through the hospital. And he yells at me and he goes, "Sue, come here, Sue, come here." And I said, "Bob, what's up?" And he goes, "Did you see the board? Did you see the board?" And what he was meaning was their goal board, which was where they posted the results of their goals. And he said, "Do you think we're going to meet our goals?" And I'm like, "Bob, I think you guys, you're 2 weeks away. I'm really sure you're going to meet your goal." He goes, "We only have 4 absences we can have this pay period. Do you think we're going to meet it?" I'm like, "Bob, it's up to you guys, but I'm pretty sure you're going to meet your goal." But that just spoke volumes to me that Bob, the midnight floor finisher, is worried. He's wondering. He's curious. He's hopeful about accomplishing this goal. It was a funny moment for us as well because he's screaming as he's saying this to me, and we're on an inpatient unit. And I said to him, "Bob, did you know that the goal on this unit is to improve the quiet scores at night?" And he laughed, and we had a nice chuckle. But it just reminds you that this can be a tactic that really is powerful and helps individuals on teams be very proud beyond their day-to-day job descriptions, beyond his day-to-day work of keeping the floor shiny and clean. He was part of something else that was important and had great meaning to him. The other thing that happened in those last 2 weeks was that one of the employees was sick. She truly needed to call in sick for her shift. Now, one of the things that they had to talk about a lot as a team was, even though we have a goal to decrease absenteeism, it's not safe to show up for work sick. So even though you might not want to let your team down by showing up sick, you can't really be a great housekeeper to keep the organization clean and infection-free if you're sick yourself. So they knew that part of the job was not to show up sick. So she knew she needed to not show up sick. But what she did instead was this. This was an organization where the housekeeping department was unionized. So they had specific rules that they had to go through to be able to replace themselves for a shift. But one of those processes was that if you wanted to, you could do a shift change. And if you could find somebody to work your shift, meaning you work their shift, they work your shift, it doesn't count as an absence, right? Because we're just doing a shift swap. So the shift isn't left vacant or filled with overtime or called off. It's just swapped. But what it means is she would need to call people in seniority order and ask if they'd do a shift change with her. And she did that. She went through the roster of her peers in seniority order, making call after call, and she found one person that would shift change with her. However, that now meant that she had to work Christmas. She was scheduled off that year for Christmas, but to not let her team down and call in sick today, she swapped and worked Christmas. wow, that is not something that would have likely happened in their department in any prior year. Think about the change in that department, the culture, the behaviors in that department, how they shifted over the course of a year because of one goal. And Maggie was absolutely right. When they decreased absenteeism, their turnover rate went down. The teamwork score on their employee engagement survey went up. Overtime went down. Cleanliness with inpatient and outpatient, the satisfaction of patients increased. And another thing happened in our organization, the infection rate was cut in half, and they took credit for it. And they should. So one goal had a positive impact on multiple metrics in the organization: finance, quality, service, people. One goal. That was one of 3 goals for their department. There was 35 different departments in this organization. So think of the multiplier of the impact of goals on an organization when you can get your goal cycle working in this way.
Thanks for tuning in to Culture Change RX. If you found value in today's episode and you are a believer in fostering change in healthcare, join us in making a difference. Follow, rate, and review our podcast on your favorite platform. Share it with colleagues and your network. Together, we can make a lasting impact. Until next week, keep inspiring positive change.